Today I am presenting my PPT on anemia from the subject Nutritional Management, and I am belonging to Department Food and Biotechnology. Anemia. It is a major killer in India. Statistics reveal that every second Indian woman is anemic. One is every 5 maternal deaths is directly related to anemia. Anemia affects both adults and children of both sexes, although pregnant women and adolescent girls are most susceptible and most affected by this disease. Anemia, its name combined of two words, its N means without and emia means blood. So it is a decrease in the RBC count, hemoglobin or hemocritic values, resulting in a low ability of the blood to carry oxygen to the body tissues. The normal values of the hemoglobin for man, it is around 13 gram per dl. For women it's about 12 grams per dl. For the pregnant women it is 11 grams per dl, and for the children from 12 years of age it is around 12 grams per dl. Classification of anemia. It is classified on the basis of causes. It may be because of blood losses, because of adequate production of normal blood cells, or excessive destruction of blood cells. And on the basis of morphology, it may be categorized into three: normocytic anemia, microcytic anemia, and macrocytic anemia. Now, on the basis of clinical picture, the anemia is classified into iron deficiency anemia, megaloblastic anemia, pernicious anemia, hemorrhagic anemia, hemolytic anemia, and in hemolytic there is thalassemia anemia and sickle cell anemia and aplastic anemia. Now, iron deficiency anemia, it is due to because of excessive loss of iron. Women are the most susceptible part because of their menstrual blood loss and growing fetus. Megaloblastic anemia, it is because of less intake of vitamin B12 and folic acid from the diet. Red bone marrow produce abnormal type of RBCs, examples like in cancer cells. Pernicious anemia are caused due to because of inability of stomach to absorb more vitamin B12 in small intestine. Hemorrhagic anemia, excessive loss of RBC through bleeding, stomach ulcer, menstruation, hemolytic anemia. RBC, plasma membrane or ruptures. It may be due to parasitic, toxic or antibodies. Thalassemia, less synthesis of hemoglobin found in population of Mediterranean Sea. Sickle cell anemia are caused due to hereditary blood disorder characterized by RBCs that assumed as abnormal, rigid or sickle-shaped cells. Aplastic anemia, destruction of red bone marrow or caused by toxins, gamma radiations. Normochromatic normocytic anemia, that is normal MCHC or normal MCV. These may includes anemia of chronic disease, hemolytic anemia because those characterized by accelerated destructions of RBCs, that is red blood corpuscles, anemia of actual hemorrhages, aplastic anemia, those characterized by disappearance of RBC precursors from the bone marrow. Hypochromatic microcytic anemia, in this there is less MCH and low MCV also. These may include iron deficiency anemia, thalassemia, anemia of chronic disease. Normochromatic macrocytic anemia, in which there is normal MCH but there is high in MCV values. It may include due to deficiency of vitamin B12 and folate deficiency. Now, moving to the sign and symptoms of anemia. Common symptoms of anemia are easy fatigue and loss of energy, usually rapid heartbeat, particularly with exercise, shortness of breath and headache, particularly with exercise, difficult concentration, dizziness, paleness skin, black cramps and insomnia. Symptoms for the anemia caused by iron deficiency, the people with iron deficiency may experience hunger for stranger substance such as pepper, ice, dirt, and this condition is known as pica, upward cultivation of nails, and this may lead to cholinakia, soreness of mouth with cracks at the corner side. Anemia caused by vitamin B12 deficiency, and these people experience vitamin B12 deficiency, a tingling, pin and needle sensation in hands or the lower feet, low sense of touch, a wobbly gait or difficult walking, clumsiness and stiffness of arm and legs, dementia, hallucination, paranoia and schizophrenia are also there. Another signs of anemia are bitter nails, spoon-shaped nails, that is also known as cholinakia, atrophy of belly of the tongue, angular stomatitis, bitter hairs, phagia or glossitis, plumper vision or Kelly Patterson. These are some signs and symptoms of the anemia. In first, there is paleness of eye. In second, there is soreness of tongue. In third, there is deformation in the nails. And in fourth one, there is cholinakia in the nails. Thank you.
चीज़ों